Good afternoon, Bahamas, and welcome back to the Hit Back. I have on the air with us, always a pleasure to have a brilliant Bahamian female leading the charge in this discussion. Not this discussion, I mean, we're not talking about COVID-19. We are living COVID-19 and the challenges that we face right on the heel of a major announcement for New Providence, with us being immediately placed on a 7-day, 24-hour lockdown, trying to get a sense of how serious this thing is, because many people are saying, look, the cure is worse than the disease at this point, calling for some semblance of balance. And I think it's always important to get the professionals, the health professionals who I have been speaking to begin to share what they're seeing and to help us make sense of it, because it hurts. This is hurting in a lot of ways. So without further ado, on the show with me right now is none other than Dr. Nikkiah Forbes. And Doc, please remind me again of this fancy title, because my tongue gets tied in your area of study. Please.
Good afternoon, Ms. Black. Thank you for inviting me back to your show. It's always a pleasure. Good
Always.
afternoon, Bahamas. I am an infectious diseases physician, specialist physician. I'm the director of the National HIV/AIDS and Infectious Diseases Program. I do practice medicine at the Princess Margaret Hospital in infectious diseases. I am one of the lecturers at the University of the West Indies School of Clinical Medicine and Research.
See, yeah, there's no way I was going to be able to say all of that, Doc. I don't even have my teleprompter working now. We're in COVID. Yeah. All right, Doc. So let's talk. First of all, we are now in New Providence, a 24-hour, 7-day lockdown. This is more stringent than the one previous. And I have to ask this because I need to know outrightly, was this the recommendation of the health professionals and the COVID task force team?
So our recommendation was the 24-hour curfew. And mine in particular did allow for opportunities for people to get food and medicine. As I've referenced before, it's for 400,000 people. It's difficult to have packages meet that need. And so if you have a population that is going to be under a 24-hour curfew, it's good to make allowances for people to get what they need. Sometimes we have to see how that goes. In the last 2 weeks, we have seen reports, social media videos of people who have used that gap in the ability to move on the streets.
Right.
Do other things, to have parties. I've seen at least 3 videos of large parties with more than 100 people. And that can be challenging. And in the simplest terms, someone said it's a lockdown with no lockdown.
Yeah. Right.
When we look at it in science terms, if people are still gathering together and there's transmission of the virus, do measures need to be enforced more stringently? That is what we are seeing. I do think that it's important to balance how people and their needs will be met, but it's awfully difficult to achieve people not moving if there are some people who out of their own free will are not willing to pay the price of controlling virus transmission. So that is what I can say, and I see that is the recommendation because there were still people moving.
Right. And, I think I'll share this with you. I don't know if you got a chance to see it. Apparently, it was just all over social media traveling. I don't know. But I wrote a post with information that I had learned through some tracers. And information that I had obtained from them was that, listen, based on our conversation, that we don't know in New Providence how bad it is. And that what was going to be recommended was a full-on lockdown. And what I think they thought, and as well as what you presented here, was that we would have some time to prepare for this full-on 24-hour period of time. And that we need to lock it down in order to fully manage it fully get a handle of it, not manage it, but handle on it. Because of the backlog, we can't see what's going on. Would you agree with that? Because of the backlog of results and tests, that one of the motivating forces for this lockdown is because we still don't know how bad it is?
I wouldn't fully agree with that.
Okay.
I hope that that wasn't conveyed, but if you're saying that that could be people's viewpoint,
Yeah.
so let's look at it this way. While we've been watching the epidemiological curve, I don't want to use jargon, but that's the number of cases every day and the trend of it.
Mm-hmm.
What do we know? From since July 1, we started to have an increase in the number of cases just about 7 days after that. Started off in Grand Bahama. Grand Bahama went into restrictions first.
Mm-hmm.
But they were the place that had the most number of active cases. Let's call it the epicenter. Some people don't
Epicenter.
like that.
Yeah, epicenter.
They say, oh, that's actually a term for earthquakes, but it's not actually true.
No.
There is a epidemiological context for it. But in any event, they had the most number of cases for a while.
Mm-hmm.
But let us look at what we learned this week. New Providence did report a large number of cases on a day-to-day basis in this past week. And if you look at the COVID-19 dashboard, which is available on the Ministry of Health Facebook page, if you look at that map of the active cases, you'll see that New Providence has taken over as where there are more cases. Grand Bahama, which went into restrictive movements measures before, has seemingly at the outset looks like it could be a little bit better now.
Yep.
What does that tell us? That tells us that there is still growth in New Providence of these cases, and that there were days that this was increasing at an alarming rate. Now, do keep in mind that we cannot see the virus. When I say that, I am not saying that flippantly. If someone is incubating COVID-19, if they don't have symptoms yet, we will not know until they present with symptoms. Some 7 days later, can be up to 2 weeks, 12 days later. And so we would have to expect that when we see people mixing, having these huge parties at hotels, we must know that COVID-19 is being transmitted. And that we won't see those people really get sick until another week or two. And it can grow exponentially when we understand that one person can impact many more. As a matter of fact, I just read in another international news online that one person exposed 800 to maybe 2,000 people at a club or something like that. I mean, you may do the same thing.
I'm aware of that. Yeah.
We know in our country we're doing the very best we can, but even resource-rich countries are having a hard time struggling with this, and so we know that we have capacity that can be under strain. You have to take a real-time decision, and sometimes that means putting in place restrictive measures, very restrictive measures, like a 24-hour curfew, like the police stopping everyone on the road and asking, where are you going? That is what we are seeing, because we understand that there were people who will just not follow the instructions. That's just how it is. We all have our own free will. Some people will not do it. So you've got to put in place measures so that that can stop. Now, the question that you asked about the backlog, we do know that there was a backlog of cases. We did ramp up capacity with the Princess Margaret Hospital coming on stream to provide COVID testing in-house, with testing being assisted with at Doctors Hospital, and the reference lab having additional support and staff and hours. And so we are making an impact in clearing that backlog. When we look at those numbers, we will have to interpret, what does that mean? When did the people get tested? When did the tests come into the lab? So that we can see and look at this curve that we have of cases and overlay this on the curve so that we can find out information in real time. In a week or from now, for example, are we seeing less cases on a day-to-day basis? What percentage of the cases that we're testing are positive? Are hospital admissions going down? Are less people dying? Those are metrics that can help us know if our measures are impacting epidemic control. So that is the actual context, rather than
we don't know.
information. Correct. That's not an accurate statement, and it's a blanket statement that doesn't get into the nuances of all of this in a scientific way.
Okay. So if we're looking at the dashboard today, one of the concerns and questions of confidence for Bahamian people, inclusive of mine, and based on what you're saying, is that if we look at the dashboard today, well, let me ask it. If we're looking at the dashboard today, does the dashboard represent current information, or is it representing results from weeks prior versus than results from yesterday? So that would be the main thing. Are we looking at current information, or are we looking at information that's 2 weeks in arrears today?
That information is the best information and data that we have that day.
Okay.
At a particular time. Say our time for publishing is 5 o'clock, but you knew when we were 5 p.m. That you knew when we were in the surge. Sometimes that got delayed, but most days there was an update of the dashboard, almost always.
Right.
So that is the information that we have at the time. So say I have a backlog of, let me just say 50 cases.
Mm-hmm.
If I run those 50 tests this morning and I get those 50 results, they get reported out into the dashboard.
Right.
So the team will still take that information in the context of the fact that there was a backlog and look at when those persons were tested. But the dashboard itself is not a full scientific report.
No.
If you may.
Right.
It accurately and transparently and honestly reports to the public the test results that we have at that time, how many tests were done, how many active cases there are, how many deaths there are, how many, which locations are impacted, for example. Mm-hmm. But there's a lot more work being done by specialists and the team members in terms of data analysis.
Good, because that would lead to the next question that I have. What sort of data do we have? I would ask the question of, let's say we test 1,000 people. Of that 1,000 people, the question would be, how many persons are completely asymptomatic versus those who have mild, then moderate to severe symptoms? And how long have we determined how long before we've gathered they've contracted to when they have begin to show symptoms of the disease? Do we have data like that? Are we growing that data? What can you tell us about that?
We're growing that data. So when there is an outbreak, we do collect information. We want to know about symptoms, symptom onset, travel, and etc. And so we will be able to tell the story. So that's what scientists do. We tell the story what the outbreak was in our location, or was it in keeping with what people are seeing in other places? Was it different? As you can see in the weekly press conferences, there is additional information. You can see there's a different curve for Grand Bahama versus New Providence versus the Family Islands, the age distribution in the first and second wave. Previously, we'd show things like people who passed away if they had comorbidities. And so, to be brief, yes, we are growing that data. We appreciate that when we give scientific reports, when we have scientific information, it changes on a day-to-day basis. If you have 5 new cases today, they have to be added to the pool. And so this information can change. Additionally, we work often in teams with an epidemiologist or a scientist, so we can tell the full cohesive story and take away any confounding factors. And so, yes, we're growing that information. I couldn't tell you, if you understand that context, that right now we're pre-taping at 10:40 on Tuesday the 18th, 50% are asymptomatic, 5% were critical, etc. It's hard to say that because remember, for each individual patient, they may start off asymptomatic, they could become severe later on today, someone could get critically ill. We have to look over time and see what happened in these people's hospital course and what the outcome is. So, it's a story that's told over time. What do we know about COVID-19? We know that most people, if they're having no other medical problems, they'll have a mild course with flu-like symptoms, could be up to 40% or more, depending on which experience you quote. That there will be persons who will have moderate symptoms, that 20% of people may be severe and 5% may be critically ill and need to be on a ventilator. We do know that, however, as it relates to who is asymptomatic, that gets difficult for the scientific community to actually answer.
Mm.
Because if you're asymptomatic, you don't know you have a
You don't know
problem.
you have it.
You can't
You
go
don't know
and
you
have
have
it,
it.
right? And so it had been proposed that maybe up to 40% of people could be asymptomatic, but we really just don't know that. So some of the information that can help to give us an idea of this is certain select groups. There was a very interesting story about a cruise that left from Ushuaia. They were going to Antarctica. It sounded like a wonderful trip. But what they did is, this was really early on. This was in, say, March or something like that. What they did was they tested everybody before they
Okay.
got on the cruise ship. And everybody tested negative. And then they had a means of monitoring for symptoms every day. You had to self-report and twice daily temperature checks.
Oh,
And
wow.
despite all of that, still about 6 people got ill about 8 days into the trip.
Oh, wow.
Because people can be pre-symptomatic, asymptomatic,
Exactly.
and have
Exactly.
negatives. And so there was an outbreak on the cruise ship, and they knew that nobody had joined the ship because it was remote. They were going to Antarctica. They didn't have anyone new join in the ports, and so this was all who was on the ship when they joined. And so anyway, when they got back to the port, because they had to abort the cruise, they tested everyone, and they took that information in terms of who was symptomatic, and they found out that maybe about 40% of people were COVID positive and asymptomatic. And
Oh,
so, like,
wow.
it's hard to know, but it could be up to 40% of people are asymptomatic with COVID-19, which really raises the point and underscores the point that doesn't matter how you feel, wear a mask, stay 6 feet away from people, don't go into crowds, don't have a party, even if you feel wonderful, because
You just don't know.
you can have SARS-CoV-2 and not even know.
How, based on what you've seen of the disease and the virus and those who have contracted the virus, have you seen what can you tell us about how people respond who are symptomatic in terms of, I've had nurses say, well, Nahaja, listen, I don't think anybody wants this type of flu because this is worse than any flu that you've ever had.
Mm-hmm.
And I wondered, based on what you have seen, how can you tell us that story about how people are reacting to it, how aggressive it is, so that we can get a sense that this isn't something you want to find yourself dealing with unless you're asymptomatic and you have nothing. So you can go from feeling nothing to then feeling what?
Well, that's right. You could go from feeling nothing to feeling short of breath and you can't breathe in a week. So
Mm,
that has been described. So some people will feel nothing. Some
right.
people may just have a little bit of a stuffy nose, maybe a little bit of sore throat. Some people could have what feels like a really bad flu. Tired, can't move, high fevers, muscle pains, joint pains. Some people will have cough, fever, and shortness of breath. Some people's oxygen levels will drop low. Some people will not be able to breathe and pass away because they cannot breathe.
Mm. So this is the extreme levels of it. How many ventilators do we have, Dr. Forbes?
I don't have that figure now. We had quite a number, and some more were donated to us. That number is something that the person who's in charge of all our supplies and equipment will have. I'm sorry, I don't have that
Hmm.
exact number now. However, what we do have is ICU capacity. We do
Okay.
know that. We have the capacity to put persons in an ICU care setting with ventilators. There are 4 in a specialized unit in the
Hmm.
Princess Margaret Hospital. Doctors Hospital West also has the capacity to put patients on ventilators.
Hmm.
And we have other ICU care, available beds. South Beach Clinic can accommodate this in the work that has been done. And ventilators were also sent to Grand Bahama to facilitate when they were in the surge.
Right. So we have, as far as you know, are we at capacity with COVID-19 with hospitalizations?
About a week ago, we were up at capacity.
A week ago. So you've seen some downturn right now, and then PMH, doctors, South Beach, to wherever we have these facilities, we are seeing a downturn right now. I don't want
It's
you to
too
commit to
early to say
anything.
that, and I would prefer not to say that because it is a little bit too early to tell.
Hmm.
with the Princess Margaret Hospital coming on stream with being able to do COVID testing, I want to say on your show publicly, Dr. Jessica Edwards, she's a clinical microbiologist, is a very, very good doctor. And I give her kudos for really agitating to get COVID testing up at Princess Margaret Hospital. And she has helped a lot. She's an amazing part of our team that
Excellent.
has helped to get us COVID test results. Turnaround time has been rapid and record time in the last few days from since they've come on stream. And so that has helped us to make decisions about the care of such patients that COVID negative can get the necessary care. They can get discharged out of the workup areas where we work up people with compatible symptoms. Not all of them have COVID. And so that may be why we got a small little bit of relief in terms of our room capacity, but it's too early to say if it's because of restrictions or epidemic management, outbreak management, versus increased testing capacity and something called increasing throughput. So I'd rather not comment on that right now, but we hope that these measures will help to take some of the pressure off the health system.
Let me ask you this. Dr. Nikkiah Forbes here with us on the Hit Back with Nahaja Black. 7 days now. We are on 24-hour lockdown for 7 days. What is the hope of this lockdown? And what would be, you believe, the measures or the results that you need to see so that we can say, all right, we can lift these lockdowns?
Well, when there is no movement, we hope that virus transmission reduces, which means that we hope that there are less cases, which means that we want hospitals not to be at full capacity. We want less people to be passing away from COVID-19 and to have a better handle on things, and for there to be less cases per day. That is what we expected. That's usually what happens when there is a lockdown. So there's been a lot of discussion about how uncomfortable lockdowns are and what you are sacrificing. And it's true, but there is also scientific information that shows that with restrictions, especially from the beginning, in China, for example, when they had curfews and lockdowns, it helped them to get epidemic control. That is a fact. And so if people adhere, if it is done properly, we should be closer to getting epidemic control. That is what we want to see at the end of the lockdown period.
Epidemic control. Sorry, go ahead, Doc. Finish your thought.
You asked, well, how do we lift these things? Well, it has to be that cases are so few and happening so slowly that the health system is not at capacity. That equals when you can start to lift restrictions. Because remember, the purpose of a lockdown is to save lives, to stop people from dying, and to give the health system a chance to take the pressure off the health system so that we're not beyond our capacity to manage sick people. So that is one of our main aims. And you can think about relaxing some of these things.
Some of these protocols. So is there a number? Are we looking at getting to 1 a day, 2 a day?
No.
And
there's generally no number. It depends on the virus and how it's unfolding. So if you have few cases and the health system is not under pressure, if you see that a lot of people are not dying, those are some of the things that we use to consider this. If you see that of the pool of tests, there's a small percentage of those that are positive, then that is how you can consider easing restrictions. So you can already see that some restrictions are lifted. Those islands that have had no cases, no persons under investigation with compatible symptoms, they are open.
Dr. Nikkiah Forbes. So right now, what we're saying is that, look, New Providence, there has been a lot of new tests, new positives per day. Right, Dr. Forbes? So we've been seeing a lot of, our numbers have been really high. We've outpaced Grand Bahama, which at one point we all would have considered the hot spot, right? This new epicenter post the opening of the country. And then, of course, New Providence now has grown to take that lead. We've seen it in the numbers. But with that in mind, we're looking at those numbers. We are at present, and I want to make sure I ask this question so people would say that, Nahaja, what are you doing? Why are you softballing Dr. Forbes? If we are seeing a downward trend in the hospital, but we're seeing daily new numbers, is that not an indication that maybe we are more asymptomatic than not? Or is it, going back to your point, it doesn't matter if we're asymptomatic, you still can spread the disease, so let's just reduce cases completely? Is that the theory there?
Okay, that was a very good question. I don't ever want you to softball me. So we don't know that we're seeing a reduction in numbers. We're still quite under pressure. So remember what I said was that with increased testing capacity, that we were able to work up and manage patients faster and get them out of the area. That it is too early to say if we're really seeing a reduction in the number of people accessing the healthcare system. It's generally too early to say that. We usually, scientists don't like to give you a sweeping absolute comment based upon a day or two. We need to take the information over time. It could just be a trend. What if I told you it was pouring rain one night, so nobody came to the emergency room? It doesn't mean that people aren't sick the next morning. They could come and say, okay,
Very good.
You understand? We see different trends in usage and usership. There are other things we need to consider. There are triage areas where people are going where they may not be all that sick. They're still getting attention. And we have to wait and see what's happening as it relates to the result of their testing. So I don't know that we're under less strain. I wouldn't want to give you that impression. It's too early to say. What we do have is increased capacity, which is helping us to manage better in terms of testing. So then the other thing you were saying about, well, in that regard, then why are we still implementing these additional restrictive measures? Remember, like I said, we know that cases aren't going down yet. Let's look at the whole picture, not just what I said to you happened yesterday when I was on call. Let's look at the whole picture. When we look at the weekly number of cases, they're not going down yet. If anything, they're going up still. That's the trend, right?
Right.
And let's look at risk behavior. We know that there are some things, not just specific to the Bahamas, not pointing any fingers, because blame is not going to necessarily help. It's what you do to close gaps, right? We know there are some things that can impact virus spread. If you have a huge party, that can cause
Most
spread.
definitely.
You have a party on a Memorial Day weekend and barbecues and people hanging out, that's going to cause spread. Not long after that, 7 to 14 days after that, absolutely you see a spike in an increase in cases. And so we ought to expect that despite the 14 days of a 24-hour curfew, unless you needed essentials, when you see that people were still having multiple parties gathering, and then you should expect that there will be a problem there. And so I would say that you have to do something to close a gap and ensure that this measure you put in place, you get the most out of it, which is stopping virus transmission.
One thing that is said since this has happened, and even Dr. Dwayne Sands has said, we need to make sure that the cure is not worse than the disease. And many today, because before we came on air today, I can tell you that you have folks protesting. They've gotten arrested based on what I've been told, because they're protesting not being able to eat, not having sufficient time or the funds. The elderly are saying, well, today was the day I get my NIB payment and now I can't get that, so what are we supposed to do? And there are a lot of people who would need assistance, even if it were for, the Prime Minister would have never done 2 weeks. That's me giving him a lot of credit. But the argument is, do the health officials, not are we, but do the health officials believe that this cure process, this lockdown process, is the best remedy? And I think you've answered it already, but I need to ask it. The best remedy that we can come up with at this time without any other necessary follow-ups, right? And did we have to do it? And you answered this at the beginning, so I won't ask that again. But is this the best remedy that we can have today? And after 7 days, do we have the proper protocols that would save us from having to do this again?
I hear you. That's the $1,000,000 question right now worldwide. So I am not a politician. I'm really just a scientist. I really just love reading books, writing papers, practicing medicine. And I don't want to wade into the realm of politics. But
Right.
I can say to you, let's be realistic. Let's look around the world. The Bahamas is not the only country that's having a second wave. We see in Paris, they're a red zone. They're going to implement mandatory mask wearing. That was yesterday. The
Mm-hmm.
Bahamas has had mandatory mask wearing now for months.
Yes.
Italy is having a second wave. New Zealand, a country that has been lauded for their approach to this virus, had an outbreak, and now they're also trying to mitigate a second wave.
Mm-hmm.
So other places in our region are also seeing an alarming increase in the number of cases. Actually, one of the countries not too far from us had 12 cases for months, and now they're up to 200 and something cases. Jamaica is also having a second wave.
Yep.
I have colleagues that work there that tell me they're also pressured on the capacity. We hear that Trinidad came out and said that they are going to not open school until December, and that they have all these curfews and measures that we have already put into place. Why would anyone think that the Bahamas is in any different special situation? You see resource-rich countries are struggling at how to control COVID-19 while we want to live our normal lives and have freedom. I by no means want to tell you that a lockdown is not difficult socially and economically. People, you have to be able to balance how people are going to meet their needs. It is important and it is challenging for all of us. We know scientifically, if you stop the movement of people, you will reduce virus transmission. We have seen that there are countries that will not do that because of personal freedoms. And what is happening there? They are now the global epicenter or hotspot for the virus. Many people are dying into the hundreds of thousands and more. And those are underreported because we know that there are deaths that are happening that are not recorded in some of those locales. And so what we have to do is balance it. And I will say to you that on Sunday, I read an editorial in National Geographic. And this is what it said, that we have a battle on two fronts. The first, the world is battling COVID-19 and trying to mitigate the spread of the virus. And secondly, we are fighting each other politically, domestically, and internationally, and quibbling and fighting over, are we willing to do what's necessary and pay the price for what's needed to contain the virus? That's the only thing I can tell you. The Bahamas has all those protocols and things in place. There was a plan. We had tests that were available in country with results available in a very fast period of time, within 24 hours for most of the first wave, which was better than we saw than in some developed countries and faster than many places in the region. We, Bahamian people, I always say, I'm a nationalist. My dad is from Andros. This is home. It's the only place that we have that we can go and stay. We took those restrictive measures. We made a huge sacrifice, and it resulted in the curve being flattened.
Yes, it was a great move.
Absolutely. There were weeks, two months almost in Grand Bahama where there were no cases. 3 weeks where we enjoyed no cases. And so
we opened up.
So going up, just like every place else in the world. Will we be willing to do what's necessary? How will we support and close gaps whilst we are doing so? And what we really need is we need unity, solidarity, problem solving. How can I help? And we need to try and troubleshoot and work out these problems in a real way that is tangible, that results in gains that will stop virus transmission. I don't tell you that I have all the answers for that, but I do know, after having worked with this team for months and longer, from the beginning, from before it was even called a public health emergency of international concern, that there was capacity put in place. And we continue to strive to increase capacity, including getting more beds on stream, supporting the islands, and increasing testing. It's all anyone can do.
Dr. Nikkiah Forbes here with us on the Hit Back with Nahaja Black. All right, final question for you, Doc. because I know that you are out there solving problems, saving lives, whereas I have nothing that, that's stunning to do.
No, no, you're helping us get that information out there. And so thank you and your media colleagues for helping to tell the story. I really appreciate you and keeping public awareness and the reality of the situation. Thank you so much for that. We don't say that often enough.
Oh, look at you. Doc, we're going to get, a glass of wine later. No need to butter up. I appreciate it. But I wanted to ask this. Are we still challenged with quarantinees? That's the only name I can give them, right? Are we still being challenged with folks not abiding by quarantine rules, even with Hubcat?
Well, it's gotten better. So there was a partnership between the Ministry of Health and National Security to help with the enforcement of quarantine.
Mm-hmm.
As you would know, that if you have many active cases in the hundreds, as you're doing your contact tracing, you will have an even bigger circle of contacts around those persons. And so we also rely on people following the instructions.
I said that was my last question, but I remember something from the Prime Minister's speech that I have to ask. He said that this is great news. We've tested or we've contacted 80%, 87% of those persons who may have, been affected, and 87% of that group. He was very proud of these two numbers, man. 80 and 87% in New Providence, and another 80 or something. The amount of persons that we have been able to contact trace. That's good news. Explain to us, why is that so great and we still got 20% missing? That 20% got me nervous, that rogue 20%. That could be about 80% is good news. That's great news. He says, this is great news. Tell me about that. What the greatness of this news?
Let me qualify that. That would be the defined contact tracing surveillance team.
Yeah.
So remember, these clients, persons will come into contact with the health center and health team and interface with many aspects of the team. So when someone gets a COVID-19 test, if it's in a health system and they have interface with a provider, when the provider gets the result, when the doctor gets the result, they will reach out and inform the person. So there should be nobody who has been tested, whose result has been done, and their provider has seen it, that hasn't had the opportunity to be
told,
contacted, right? So I should think that information related to the contact tracing team. So remember, we have a defined surveillance team.
Yeah.
But their only responsibility is following up with cases who should have been informed by their clinician already.
Yes.
And is saying, how are you doing? But I now need to interview you, correct? I need to interview you and say, could you please give me your list of contacts and who you have been in close contact with? Who do you live with? Who do you work with? Do you share an office with anybody in the last defined period? And then it will take time to reach each one of those persons and find out, have you had symptoms? We recommend that you get tested. That does take time. The capacity for this unit has been increased, as we have heard in the weekly press conferences from the Ministry of Health, and they have been supported to have extended hours at a location that they are working out of. And so the context for that is not across the board. It's in terms of what contact tracing and surveillance is doing. They're continuing to do that on an ongoing basis. We also need support for that. So I'm glad you asked me on your show. So I'll also ask the opportunity for any providers that are listening out. Please, we need some relevant information on these forms when we're testing persons.
Relevant information. Okay, go ahead.
We need their cell phone number. We need certain information. It is very prescribed on the form. We need it to be filled out completely, because if someone tests positive, the quality of that information helps the contact tracing unit and surveillance reach out to the person. So if someone fills out the form and leaves out the person's cell phone number, it gets awfully difficult to contact them. And so they are having some small little challenges like that. I wouldn't call it small. They're having challenges like that. And so there is a context to this, and it's ongoing work.
Oh, that's good. You helped to explain those numbers to me wonderfully, because that was not even, I needed some clarity. So thank you. I appreciate you, Doc, for that.
Anytime.
Dr. Nikkiah Forbes, everyone, are professionals on the front line. And I will say hello to all of your fans, Doc, for you, because you
Thank
have
you.
a huge contingent of fans, especially in my neighborhood. Anyways, Doc, have a great one. Thank you so much. And you're listening to The Hit Back with Nahaja Black. When we come back, let's talk a bit more about this lockdown, y'all. 7 good days we're going to be locked down. We'll be back after this.